Today's hearing with fired CDC Director Dr. Susan Monarez and former CDC Chief Medical Officer Dr. Deborah Ori comes just one day before Secretary Kennedy's revamped and much scrutinized vaccine advisory panel is set to meet. Both Monarez and Ori voiced concerns about the recommendations that may come from that panel during their testimony, while Republican Senator Bill Cassidy, who of course chairs that committee, went even further in comments to reporters after the hearing.
If the vaccine advisory panel makes recommendations to change the childhood vaccine schedule, should the American people have confidence in that decision?
No, because this data clearly shows that when you give the mother an option, it's not a mandate, you give the mother the option. And if she has that option, she can elect to have her child vaccinated. And we've shown that, as I quoted the data, I mean, we have decreased from 20,000 kids a year getting hepatitis B to like 20 a year. That's exponential decline.
Cassidy, who again is a medical doctor, gave a full-throated defense of vaccines during today's hearing, specifically that hepatitis B vaccine, using RFK's own tagline to underscore its importance.
Fewer than 20 babies per year get hepatitis B from their mother. That is an accomplishment to make America healthy again. And we should stand up and salute the people that made that decision. Because there's people who would otherwise be dead if those mothers were not given that option to have their child vaccinated.
And joining me now is Dr. Demetre Daskalakis, one of the several top CDC officials who resigned in protest last month following Dr. Monarez's firing. Doc, I hope I'm pronouncing your name correctly. I apologize if I'm not, but I want to start with your reaction to seeing your former colleagues in their testimony before Congress today.
So first, you pronounced it great, so thank you. And I think that really looking at Dr. Howery and Dr. Monarez, I think that they did a really great job expressing, what's happening within the CDC, which is that the scientific process has been compromised. Science isn't ruling decisions. It's not ruling the process. And if you can't trust the data that underpins a recommendation, you can't trust the recommendation.
What is the mood within the agency? I mean, we heard from Dr. Monarez talking about all these negative things that Secretary Kennedy was saying about the CDC, an agency under his direction.
I mean, I think it's fair to say that the mood there is dark. I think having a leader who is really targeting your organization to discredit it, to make the science that underpins all of the work that you do be suspect. It's not what public health should be dealt with. It's not how it should be treated. And these folks who work at CDC are really amazing scientists and, most importantly, public servants. 24 hours a day, 7 days a week, what they care about is maintaining the health of people in the U.S. and the globe. So hearing someone saying that they're killing children, hearing someone saying that they're horrible people, take a mirror and look at that and say, listen, like someone who's telling you that you can't trust your doctor and you can't trust the people that are working for you to make sure that you're healthy, you have to question if you should be listening to that person at all.
Well, and to that point, I mean, you heard that from Senator Cassidy, very much making that point, saying that you won't be able to trust the recommendations that come out of this committee tomorrow. Do you agree with that, Reed?
I mean, I think we have to watch that committee really carefully tomorrow. I'll tell you that, the early signals, I've already looked at the data that they're starting to post for the meeting, and it seems as if it's fixated on risk and not anything about benefit for how these vaccines work. And so I'm worried that they're going to really be focusing on only downsides, and not even downsides that have strong or vetted data, but downsides that serve the purpose of budging the children's vaccine schedule.
Well, I feel like we should back up a little bit for people. I mean, you heard Director Monarez testifying today that Secretary Kennedy claimed there's no scientific data behind the childhood vaccination schedule. Talk to us a little bit about how those recommendations for the schedule actually are reached.
Yeah, so it is a very rigorous process. The way that it's done is that a new vaccine, something is considered. CDC scientists pull all the data. They go through a very rigorous process to make sure that the data is of the highest quality, that there's no bias. They then package it. And then they have more conversations within their work groups to come up with an evidence to recommendation framework where it really is something that you present to the folks at the meeting to go through everything very systematically. Like is this a real public health problem? Is it implementable? What is the risk-benefit ratio? And they do that, present it to people who in the past have been vaccine experts, and then come up with recommendations to the director. This is not what's happening now. Instead of having a months-long process to review data in a very methodologically sound way, there is an agenda item that the secretary says we're going to have to do the next month. All of a sudden, the scientists have to scurry to put things together. They have to be responsive to the ACIP members who really have, I think, different strategies and different goals in making sure that the health of children is maintained. And so the process has broken down. And so what usually happens is order and review. What's happening instead is kind of chaos.
No, it's interesting to hear you describe that. I mean, my day job as a White House correspondent, I see the different ways in which this administration is sort of upending or removing process across different elements of the way that the government functions. They're not, as a general rule, interested in kind of the way things are traditionally done to reach some of these conclusions. The last time you were on this program, you said that Americans should look to their own doctors, to their pharmacists, pediatricians, for guidelines around the vaccines in the wake of all this turmoil. But if everybody's talking to just their own pediatrician about this, do you worry that that increases the likelihood of kind of healthcare disparities, sort of information deserts around the country where the information might not be as good? It sort of turns everything into a free-for-all, basically?
I am worried about that. I think the reason that CDC is so important is it creates a unified set of recommendations that pediatricians and other physicians are able to follow. In a universe where you can't trust the CDC recommendations, those pediatricians really need to look at their professional organizations like the American Academy of Pediatricians, like to just make sure that they're getting the best data and the best guidance. So I am worried about it. And that's why there's an existential risk to public health, which is an existential risk to the health of Americans.
Dr. Daskalakis, we have to leave it there. I have so many questions about how to restore that trust, but if we could solve it in an hour, we'd both probably have different jobs. Thank you for being with us and bringing us your expertise.
Thank you.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.